Hi, I am Shailesh Hadgaonkar. I am working in Sancheti hospital as a spine surgeon over a period of more than a decade. Today I am going to discuss with you the advances in the management of spinal ailments, the spine treatments and spine surgery. People are always curious to know about the minimal access spine surgery, and they want to know is there is something which can be done in a small keyhole or microscopically or minimal invasive surgery as it is happening in most of the other fields. And yes, spine surgery is also evolved in last 2 decades significantly, and we are lucky to do our own bit in terms of minimal access spine surgery. We are doing the minimal access spine surgery for around the period of around 10 to 12 years now, and our experience in this minimal access spine surgery is doing the microscopic, microendoscopic, tubular decompression surgeries mainly for the trapped nerves and the stenosis, where we can use the minimal invasive access and we can see it through the microscope, and the surgery can be performed. What all are the advantages of this minimal access surgery? People are always concerned whether you do the minimal access and you do a minimal job. It's not like that. You can have a very good vision when you have appropriate instrumentation, and we are lucky to have all the possible best instrumentation required for spine surgery in our department. With this minimal access, we have the small cut. The surgery will always have less time consumption, less bleeding during the surgery, less time of recovery, because today's age people don't want to lie down in bed for a longer time. They want to get up and about very early, and this is where the surgery is evolving. And we do this minimal access surgery for decompression of the spine, the lumbar disc prolapse. We do it for minimal invasive fusion surgery, what we normally call the minimal access or MIS spine surgery, the minimally invasive microendoscopic spine. We can do this minimal access where there are small cuts for the instrumentation to go, where we do the fusion in spine. We do this surgery for even spine trauma as well, because in a lot of cases where we don't need to do major cuts, where we can use this minimal access to fix the spine. So I think there is definitely a big role of minimal access spine surgery or minimally invasive spine surgery for betterment of patients, and we have to be selective when we decide to do this minimal access surgery. We are here to help in whatever best possible way for dealing with the spine problems. And one thing for sure, I just want to tell you, spine surgery is required for only 5 to 6% of the patients who have problems. 95% patients can really get better with a good rehab, good physio and good care. Be safe, and be sure that we are going to help you in whatever best possible way. Thank you. Stay safe.